This conference will now be recorded.
You ready?
Yes. I think we're going to
Good morning. Hello, everyone. I'm Doug Reeder, and I want to go ahead and get the introductions going. We appreciate you participating in our program this morning. I am the chairman and a co-founding partner here at Sterling Seacrest. We're a multidisciplined commercial insurance agency with deep industry roots in healthcare, construction, real estate and hospitality, transportation, logistics, nonprofit, and private client risks. We also have a very large benefits consulting practice, which transcends industry groups. Thanks for joining us for our Sterling Seacrest Partners University program today. In this program, we attempt to curate programs of interest to our clients, friends, and colleagues across a broad spectrum of topics driven by a holistic approach to risk management. We certainly feel like today's program accomplishes this goal as we have a large number of internal and external attendees. Thanks very much for participating. Today, John Mudrock, co-founder of Medicare Plan Pros, is going to teach us his 3-2-1 approach for answering all your Medicare questions. As a co-founder of Medicare Plan Pros, John brings 13 years of Medicare industry experience in the state of Georgia. His first 10 years in the industry were spent with Humana before venturing out in 2015 to start what is now Medicare Plan Pros. He likes to take a consultative approach with his clients, educating them on all of their options so that they may make the best decisions for themselves. He has been a very valued resource to our benefits team here at Sterling. Born in Cleveland, Ohio, he's lived in Atlanta since 1977. John earned his BBA in risk management and insurance from the University of Georgia and also played for the UGA Rugby Club during his time in Athens. He's married with a son and daughter, spends his free time on their activities, of course, and enjoys playing golf and vacationing in Charleston, South Carolina. Please join me in welcoming John Mudrock. Thanks, John. Thank you. You want to go ahead?
Which one are you looking? Am I looking up that way?
The camera is facing us.
Both.
Everywhere. Okay,
That
awesome.
one's not on too?
That one.
Yeah.
Just that one.
Oh, just that one is.
Well, thanks for having me. I really appreciate the opportunity. I hope you guys will find this beneficial. Doug did a good job of introducing me, so I don't have anything left to say, really. But so what we're going to talk about today is I eventually want this to be an open-ended discussion, but I'm going to give you guys the basics of Medicare, who's eligible for it, the best ways to go about doing it, and then we'll talk about specific things with regards to employer benefits and how it relates to going on to an individual or private Medicare plan. So what is Medicare? Medicare is just the federal health program for people 65 and older, as well as folks with disability. So somebody who's 40 years old and disabled has the same rights as a 102-year-old that's on Medicare. Sometimes that gets lost by those folks that are on Social Security through disability. This is the big part that we'll kind of talk about today. So what are the parts of Medicare? We're going to go through all these, but you see here you've got Part A, Part B, that makes up original Medicare. You've got Part C, which are your Advantage plans. You've got Part D, which are the drug plans. And then you've got Medicare supplements as well. Feel free as well. I think Katie's going to monitor the chat, so you're welcome to stop me at any time if you have questions during this, but we'll definitely open it up at the end as well. So part of original Medicare is Part A. That's your hospital insurance as far as Medicare is concerned. That's typically a zero premium for most people. You've paid, quote unquote, into the system your working life. This has this actually doesn't have an annual deductible. It's got a benefit period deductible of $1,408. So the interesting thing about Medicare's Part A deductible is that's only good for a 60-day benefit period. So technically, you could go into the hospital January 2nd, owe that $1,408 and 20% of the bill. Then you could go back in March 4th and you're past your 60-day benefit period and you could owe that deductible again. So that's just one of the reasons you don't want to, in my opinion, be on just Medicare alone. So that's your Part A of Medicare. It typically covers your hospital, what we call hospital insurance, and then it covers these things too. Part B is your medical insurance, or what we call doctor's insurance sometimes. The standard premium for Medicare Part B is $144.60. That does tend to change every year a little bit. Something to really take a look at is this is income sensitive. So whenever we're looking at whether or not it makes sense for an employee to come off of their employer plan and go on Medicare, we do sometimes need to take a look at Medicare. And after the presentation, I'll show up the income sensitive chart, because it goes up to as much as roughly $490 a month to be on Medicare. So that's a lot of times a factor. Part B of Medicare has a $198 deductible. That is just a true annual deductible. So it's just one time. And then after that, Medicare would pay 80% and the beneficiary would owe 20%. These are some of the things covered by Part B. Home health care, doctor's visits. One of the questions that always comes up as far as home health care, Medicare does not cover long-term care. That's a separate long-term care policy. Home health care with regards to Medicare is skilled nursing at home. Medicare does cover you for skilled nursing in a facility, but again, that's not activities of daily living. That's not transferring, toileting, feeding yourself, bathing, things like that. That's skilled nursing when the prognosis is you are going to get better. Here again is just an outline of the Medicare cost and deductibles associated with 2020. Those come out, the next year's numbers will probably come out in the next month or so. I mean, of course, why would they bring them out before the Medicare enrollment period starts, which was October 15th, but you know, to make an informed decision, but we should know those shortly. They're usually pretty much in line from year to year. You don't see a huge increase. So here's some of the things that original Medicare does not cover: dental care, eye exams related to glasses, massage therapy. I don't think you guys even have policies here that probably cover massage therapy. I'm not sure why we threw that one in there, but long-term care, hearing aids, things like that. So that's where these options come in. It's not that 20% of a doctor's office visit is going to send you to the poorhouse, because it's not. But the problem is that hospital deductible is potentially 6 times a year. Chemotherapy is something that's covered at 80%, 20%. So with no out-of-pocket maximum on Medicare, there's no limit to the 20% you can owe. So with all the programs out there, it really makes sense to go on something. And I tried to break it down into what I call path 1 and path 2. Path 1 is what I call just your traditional supplement. So a lot of times we use that word supplement for everything, but there really is a difference between supplements and advantage plans. But on path 1, you'd have your original Medicare, you'd have a supplement. Supplements by law do not have prescription drug coverage, so then you'd have to pick up a Part D plan separately, so that's why you see that plus symbol. Or path 2 would be to have a Medicare Advantage plan, and that's just where the private insurance company becomes your Medicare, and we'll talk more in depth about both of these. The key to either of these is that you have to be on original Medicare to be eligible for either of those. So I like to say what happens between you and the government stays between you and the government. So if you're paying the government $144.60 to be on Medicare, that's going to stay the same whether I walk into your house or don't walk into your house. I know it's coming out of that person's budget, but a lot of times they'll throw that into the cost of the supplement, and I just try to say that's happening no matter what you do. So generally speaking, supplements help cover the costs that original Medicare doesn't. So you're not purchasing a supplement to cover benefits that Medicare doesn't. So a supplement's not going to pay for cosmetic surgery or things like that. But if it's a Medicare covered event, the supplement is going to pick up generally the 20% as well as the deductibles. Some things about supplements is that they're standardized. So there's kind of an alphabet soup of letters of supplements. You've got a plan A, a plan F, a plan G, a plan C. The key to that is a plan G, which is the most common one, so I'll probably refer to that a lot today. A plan G supplement is standardized no matter who you get it from. So whether you get it from United Healthcare or Blue Cross Blue Shield, Humana, Aetna, offers the same exact medical coverage. And for instance, with the Plan G supplement, the reason that is a popular supplement right now, the only thing a Plan G supplement does not cover is the Part B as in boy deductible, which is $198 this year. So between what you're paying Medicare and then somebody turning 65 in Metro Atlanta, you're probably looking at $110 a month for a female, maybe $120 to $125 a month for a male. You could get that Plan G supplement for that $110 or $125 a month. So basically for $125 a month, you can get a plan that limits your out-of-pocket exposure to the first $198. So it's usually a pretty good deal for folks. The only difference is there are some supplements that cover the Silver Sneakers program. If anybody's on Medicare or has relatives on Medicare, some of the insurance company offers Silver Sneakers, which is a fitness center membership. So they actually get full use of gym memberships at no cost to them. I think if you have Blue Cross, it's on that one. Certain times to buy a supplement. This is pretty important. So supplements are different than Advantage plans. When you're first turning 65 or when you're first getting Part B, and again, this will come up some more later because there may be folks that work until age 68, work until 72, work until whatever age. But your Medicare enrollment, your Medigap or your Medicare supplement open enrollment period begins when you pick up that Part B. So even if you wait until age 68 to get Part B, you're still able to get that supplement with no health questions asked. Other than that, there's very few times that you can get a supplement without going through underwriting. So everything that you're seeing on TV right now, if you're watching commercials and seeing the Medicare open enrollment period, it really doesn't apply to supplements. The Medicare annual enrollment period applies to Advantage plans and prescription drug plans. You can change your supplement any time of year because you're subject to health underwriting questions. So as long as you can get through underwriting, then you could change your Plan G from company XYZ to company 123 if it's a better premium. So that would be the only reason you're changing is because you're shopping your premium. Prescription drug plan, this was kind of that second part of Path 1. By law, Medicare supplements do not cover prescription drugs. So you're getting Medicare Part D from a private insurance company. Again, there's certain guidelines. They're not quite as standardized as supplements, but they do have to follow certain guidelines. Anybody who's been through this may have heard talk of the coverage gap or the donut hole. That's where the insurance company kind of starts paying for some of those drug costs. And that stays the same with each company. So the government sets a number every year, and that's kind of what this slide is about here. So this gets confusing, so probably we'll handle this on a one-on-one basis, but this is just showing the standard for a drug plan in the year 2020. The worst benefits that can be offered by a plan would be that it had a $435 deductible. It doesn't mean that it has to be that high, but Medicare says that's what you could charge. You've got your initial coverage period, which goes until the total cost of your drugs reach $4,020. This is where it sometimes gets confusing because you might have a $47 copay for a drug, but if that's a $300 drug and you're paying $47 and the insurance company is paying $253, it's the $300 that puts you towards that donut hole or coverage gap. So that causes a lot of confusion. We have a question? Are we okay?
I was asked to mute people. They're hearing
Oh,
heavy breathing or something.
hopefully it's not me into the microphone.
So I'll just have to unmute them for them to talk.
And then then you've got, after that amount, you'd hit that so-called coverage gap or donut hole, and that's just where your copays wouldn't really apply, and you get more of a discounted cost for drugs. And then when you've reached 6,350, that's your true catastrophic limit on prescription drugs, and you pay no more than 5% of the cost of your drugs at that amount. Typically, most people don't hit that, but it's important to know what it is in case you are one of those people. I think it's around 17% of the folks hit that donut hole. And actually, a big factor in that was insulin. So actually, they just passed a few months ago an insulin or diabetic protection plan. So next year, insulin, certain Medicare Advantage plans and prescription drug plans are going to offer insulin for a $35 copay the entire year, even through the coverage gap, because that's a very expensive drug that a lot of times puts people in the donut hole. So the other option, the path to option, is the Medicare Advantage plan. The Advantage plan is where you're having the private insurance company become your Medicare. Again, you haven't lost Medicare, but you're just choosing to have Humana or Aetna or United Healthcare become your Medicare.
We had a chat.
Okay. We're just waiting to see. We think we have a question, so.
It's from Karen.
Oh, perfect. Okay. I made a comment about massage therapy, and I didn't mean for it to be a joke, but it was kind of a joke. So I apologize for that. But apparently there are certain times that massage therapy is covered. I don't know about that on Medicare, but it looks like maybe massage therapy might be covered on some group plans after potential cancer. So that's a good thing to know for those folks. So I apologize. Sometimes I bring humor in, so I hope that wasn't offensive to anybody. So these are some of the things that happens with a Medicare Advantage plan. You're going to get some preventive costs. Well, you're going to get all your preventive costs covered. But the big thing with an Advantage plan versus original Medicare is these plans by law have to have an annual pocket out of maximum. So that's a big thing. Let's go back here one slide. So when you do an Advantage plan, you're getting your A, your B, and most of the time your D coverage in that Advantage plan as well. So you're getting your doctor, hospital, and pharmacy coverage, your Part D included in this. Here's the part that gets a little mind-blowing sometimes for folks. So what happens on these Advantage plans, a lot of times, especially in Metro Atlanta, because it's a very competitive market for Advantage plans, these Advantage plans come with a 0 monthly premium. So other than what you pay Medicare, you could sign up for an Aetna plan or a Humana plan or what have you, and that is a 0 monthly premium. Now, the difference being Advantage plans come with copays. They're going to look more like a plan you have through your employer, through group coverage. So you're going to have maybe a $5 copay at your primary care doctor, a $35 copay at your specialist, $300 a night for the first 6 nights in the hospital, things like that. You're going to get some extras in Advantage plan, because if it was just covering what Medicare covered, well, nobody would sign up for it. But you do get that annual out-of-pocket maximum, so you get that protection. The plans will throw in dental. So whereas you don't get dental with original Medicare and a supplement, you would get dental here. You would get vision. Medicare only pays for glasses your first time after cataract surgery. A lot of these plans will throw in, $100, $200, $300 for glasses. These plans, a lot of these plans now cover transportation. I think the insurance companies have realized we've got people sitting at home that are sick that maybe can't get to the doctor. So some of these plans will actually cover 36 one-way trips to a doctor's office visit. people laugh when we say one-way trips. It's so you can, maybe they have a son or daughter that can take them one route, but not the other. So you can use the 36 one-way trips, however you want, one leg of it or two legs. So that's, you get a lot of perks with Medicare Advantage plans. So even in a scenario where somebody thinks that they don't want to pay for a supplement, it would make sense to at least go on an Advantage plan. It's a zero premium. You're at least giving yourself an out-of-pocket maximum protection. This is a comparison chart with Advantage plan supplements and original Medicare. I think it's a little bit misleading because it makes it look like supplements aren't good, and that's not meant to be. But so what I try to do is I sit down with folks and, well, we'll go back to it in a second. I wouldn't really use this chart. I would sit down with folks and we will go through a consultative approach and find out what works for each individual. I tell them, don't do what your neighbor did down the street. Don't worry about what your aunt or uncle did. Let's do what works for you. Don't ever pay somebody a consultation fee. There are some agents that might charge a consultation fee to give you this information. That's, in my opinion, that's not the route to go. If you use an agent, so if you use somebody like me to enroll in one of these plans, I am going to get paid by the insurance company. So it's just in my best interest to put you in a plan that works for you. I try to make sure that you understand it. And I even have some households where the spouse goes on one person goes on a supplement, one person goes on an Advantage plan. So you can do it however you want. This is talking about initial enrollment period again, is that those 6 months surrounding your 65th birthday. It's also can be for folks that are working, like I said, really when you pick up Part B. A lot of things that come up in working with Sterling Seacrest and their partners and clients is, what do I do? I'm turning 65. Do I have to go on Medicare? And the answer is no. If you have the option to be on a group health plan, you do not have to go on Medicare. I have run across a few people that have picked up Part B really when they didn't have to. If you're staying on your group plan, there's very few times that you'd need to pick up Part B and pay that extra $144 up to $500 a month. These are some of the ways to enroll. Typically, you can do it online, which really is the best way to do it right now, would be to go online. I'm going to show a few more PDFs that's also going to bring up this 3-2-1 approach. But right now, I want to open it up to questions, and then I'm going to show a few more things that relate to coming off employer questions, or at least we'll pause and see if we have any questions. Anybody, any questions yet? I think did you unmute?
I did.
Okay, so everybody's unmuted. If you have a question, if you don't, that's okay. Or you can still go in through the chat.
You need to pull up.
Yeah, the PDF, I'm gonna pull up the PDFs.
Oh, there's Karen again. You're working and about to turn 70.
If you were, all right, so Karen says, if you were working and about to turn 70, is it mandatory to have Medicare as primary? No, it is not. So a lot of times that question comes up because I know people are under the gun to start taking Social Security. So a lot of times we get confused with, am I taking my Social Security benefits? And does that mean I have to take Medicare? Again, if you're still working, you can choose to take delay Part B until you come off of that employer-based coverage. So no, as far as having Medicare primary, that's all based on how many folks are in your group plan. If your group is less than 20, I think that's the number, Medicare is primary. And if not, your group plan is primary. So does that answer your question, Karen? Let me pull up the 3-2-1 approach, I think. I think it's the one on the top right.
I'm sorry.
That's all right. So this is one that, this is just a file that I've developed specifically with Sterling Seacrest, answers the question, I'm working and I'm turning 65. What do I do? So the best thing is to reach out to somebody. You can reach out to me. Even if you don't reach out to me, reach out to some sort of Medicare expert. And what we'll do, if you're going to continue working past 65, like I said, you do not have to go on Medicare, but it might make sense to do so. So we'll look at things like, what is your contribution to your group plan, your group medical plan? What kind of deductible do you have? So we'll look at your exposure through your group plan and we'll see if it makes sense to maybe pick up a Medicare supplement or maybe pick up a Medicare Advantage plan. But again, you do not have to do that. Second question is, I'm working, but I'm over 65 and I'll be retiring soon. So that's, definitely where you need to do something. That's where there will be some special forms that you need to fill out to take Part B if you don't already have Part B. They're really simple forms. There's a one-page is your actual application for Medicare Part B, and then the second page is something that your employer fills out just to show that you had employer-based coverage so that you're not penalized. But then you're going to have your initial enrollment period for choosing either a Medicare Advantage plan or a Medicare supplement based on the fact that you're picking up Part B, even if that's at age 70 or age 72 or 74. Is that a question up there? Somebody?
Oh, it was Karen?
Okay.
Maybe. No, I think it is a question.
So Karen says, I have been using employer plan as primary and Medicare as secondary for out of pocket. Yes, I mean, that's true. So I don't know if you have, Karen, I don't know if you have Medicare A and B, but even if you just have Medicare, your employer plan is going to be primary and Medicare would be your secondary if you're in a large group or larger than 20 group. I'm going to pull up the HSA one. Let me see that. I think that one. Yep. So you scroll. So this is something that has become more relevant in recent years as more groups are on high deductible health plans that are HSA compatible. So a lot of times, as I said, you might be working and still on your employer-based plan, and you do take Part A because Part A is free and it really doesn't do anything. The caveat to that is if you're on a high deductible health plan with a health savings account, you cannot take Part A. There are tax implications. That HSA money that's put into your HSA account would then be taxable, is how it works. So contact your accountant for the actual rules on that or the tax penalties on that, but I know that is something that you do not want to do, is take Part A if you're going to contribute to an HSA account. And again, so that goes in line with if you know you're going to be retiring 6, 8, 9 months from now, and you do have a high deductible health plan with an HSA, you need to stop contributing to that 6 months prior to going on Medicare Part A.
FSAs aren't the same thing.
FSAs are not the same thing. Good question. Yep. So completely different than a flexible spending account. That's different. This would only be health savings account, HSA. So this is a PDF that I can make available to anybody who wants it. I'll send it out, or Katie can send it out. We can do that. Other important thing, do we have any questions on the chat or no?
No.
Okay, it shows there. Some other very important things are questions a lot of times come up with COBRA. COBRA does not give you a special enrollment period to hop off of COBRA and go onto a Medicare plan. So if you're leaving work and you are Medicare eligible, you need to really do some research into that if you are going to take COBRA or if you're going to go on Medicare. So for example, let's say you're leaving work, you're 68, you're eligible for Medicare, but you choose to take COBRA. 6 months later, you say, I think I'm done with COBRA. I want to go on a Medicare plan. That does not give you, in Medicare's eyes, a reason to go and sign up for Medicare Part B. So actually learned that about 5 or 6 years ago from, a client here. And what happens is you would then have to wait until Medicare's general enrollment period, which is January 1st to the end of March, I think, to sign up for Medicare Part B. And then your Medicare Part B wouldn't be eligible until July of that year. So you have somebody that wanted to come off COBRA in August and maybe thought that they could, they then would have to wait until the next July for their Medicare to start. So again, it's important when these things come up to talk to a Medicare advisor, like again, myself or anybody else that knows.
Hey, John.
Yep.
Sorry, go ahead. I was just trying to, so if do they have to come off COBRA and then wait until?
Yeah, so it would have to be, they'd really have to time and decide, what they wanted to do. There's some, there are, like all this stuff, there's crazy caveats. So I'm speaking in general terms, because there are some caveats where the family can stay on COBRA, but the Medicare eligible can't. Yeah, so there can be times when, it makes sense for them to take COBRA so they can cover their non-Medicare eligible spouse and kids, but then they have to do something different. So as always, there's caveats, but generally speaking, just need to be careful and do some research before you choose one or the other when it comes to COBRA.
John, if they exhausted their COBRA for 18 months, then they could come on?
That's the tricky part. No, so let's just keep it simple right now. So somebody took COBRA, but they did not have Medicare Part B, and it's just a single person. So they didn't have Medicare Part B, their COBRA ended in June. As far as Medicare is concerned, even though your COBRA ended then, you do not have a special enrollment period to pick up Medicare at that point. You'd have to wait to that general enrollment period. Yeah. Yeah, it gets, yep.
Seems like they're forcing to pick up.
Kinda.
They're trying to force you to pick up Part B the minute you're.
Yeah.
Because you're not gonna know, like,
What's.
you could be sitting there in June and you lose your job, so now, but you're able to do COBRA.
Right.
And so you chose it because you lost your job. And you needed to have been looking at that 3 months before that, and you had no idea you needed to be looking at it.
Right. So that is pretty much everything I had to talk about today, but want to keep it open to you guys. If anybody has any questions here, don't be shy. I know you have questions.
When do they have to stop? I can't. When would they have to stop contributing to the HSA?
You'd have to stop contributing to the HSA 6 months before taking Part A. Otherwise, there's tax implications. You're not going to go to jail, but something happens with those funds that are in that HSA account that then become taxable. That works.
You gotta send a check to the government.
Yes, exactly. Yeah. So I guess you could go to jail if you don't pay the taxes. So yeah.
That's right. Yeah, and you in their court, you're guilty.
Question from Karen. It looked like any complaints about adequate networks under Medicare Advantage plan. So that's a good question. So pros and cons, and I'm going to get to it in a roundabout way. So pros and cons about supplements versus advantage plans. So one of the pros of going with a supplement is whether it's Humana or United Healthcare or Blue Cross, there is no network. It's just, does the provider take original Medicare? So when you have original Medicare and a Plan G supplement from Blue Cross, you're not calling up your doctor saying, do you take Blue Cross? All that matters is, do they take original Medicare? When you have an Advantage plan, the Advantage plans, they are network-based plans. They are HMOs, they are PPOs. So just like you have through your employer-based coverage, you've got to check and see if they're in network. With that being said, in the Atlanta market, Atlanta's got one of the highest penetration markets for Medicare Advantage plans, which is up around the 40% mark. I think the rest of the country is around 30 or so. So the networks are very, very competitive here. I technically can't say all or everybody, but if you look at, like, my two most competitive PPO plans as far as Medicare Advantage are Humana and Aetna, and virtually everybody in the Atlanta area as far as hospitals are in those networks, whether it's Wellstar, Piedmont, Emory, Gwinnett Medical, DeKalb. I know some of them combined now. I haven't kept up with who's under what umbrella, but most of the major hospital networks are in both of those networks. And then even the HMO plans have pretty strong networks as well. So I would say not a lot of complaints. There's always going to be the one-off doctor, Karen, that's not in the plan. But it's not a huge issue as it was when I came into the business about 15 years ago. The networks weren't that big because the Advantage plans were kind of just coming around. So the carriers have now built their Medicare Advantage networks up pretty big.
This is something we can share with our partners.
Sure. Katie warned me not to, but I said I would do it. So I'm kidding. Sometimes I get overly protective about my stuff and I don't know why, but yes, you're welcome to share it. Definitely especially the PDFs, because I really did the PDFs with you guys in mind, like the HSA PDF. There's a second HSA PDF as well. We don't have to go over it, but it's available to you.
Well, you know.
Yeah. No, I know.
Right.
I know. Yeah.
And you're the natural guy to call.
Yes, exactly. I tease about that.
Said she gives your name out, Rick.
No, I know. And again, I appreciate you guys here at Sterling Seacrest, definitely.
I didn't want to hear your question.
Oh, sorry. So if you have an employee base that's on the older side,
Mhm.
which we do, probably over 50% or over 50, at what age would you want to expose them to some of this information so that they, even if they're not ready to make decisions or need to make decisions right now, they need to at least have the information so they know as you're approaching that age, here's when you might need to start kind of getting this all in your head.
So I missed the first part. So you said that are in this already over 65?
No.
Okay.
So our employee base, 50% of our employees are over 50.
Okay. Gotcha.
But, as a service to our employees, they may need to kind of get a head
Sure.
start on all of this. And like, when would you recommend that somebody start kind of just getting themselves acclimated to this kind of information so that they know there's some timeframes that they need to be careful about?
Sure. I mean, usually I wouldn't look at it more than a year out, age 64.
Okay.
Would be probably a good time to do it. But I'm also available, like if anybody wants to use me to come out and talk to your employees, even if they're not in the 64 age range, I'd be happy to come and do a similar presentation for them, just so they know what's down the road.
Right.
But they don't really need to do it actively until age 64. But, and if you have any employers out there, if you've got employees that are of Medicare age already, I'm happy to do that presentation too, because sometimes there's a fear factor of, I don't want to go on Medicare. I want to stay on my employer-based plan. But when they sit down and they look, and if some of your employees are in that range where they would only pay $144 to Medicare, they'd pay $120 for a supplement, and then their total out-of-pocket cost for medical would be $200. I mean, it's a no-brainer. And then even some people, you might have a 5,000, even some of the plans have a, $2,500 deductible and a $5,000 max. I mean, and that's not a bad plan. You could, and they're paying $200 or $300 a month to be on the employer-based plan. You can even make the argument that they could look at an Advantage plan, because an Advantage plan, they're paying the $144 to the government, and then the Advantage plan's a zero premium. They're not paying anything for it. The Advantage plans don't have deductibles, and they have to have an out-of-pocket maximum. So you could get a plan for zero that has a $6,700 out-of-pocket maximum. That's a good situation too. So a lot of it, sometimes people are just afraid, I don't want to go on Medicare. I'm not going to be able to see a provider, but most of your providers out there accept Medicare, right? They're not making their money off of 30-year-olds out there. They're, the cardiologists, they're seeing folks on Medicare or Medicare eligible.
That sounds like a pretty good offer. You got some 65-year-olds in the mix.
Look at that.
It really
In
is.
the age. So I have one other question. So you've mentioned age 65 several times. But I know from personal experience, everybody doesn't go on Social Security at age 65 anymore. That eligible date is different, or age date is
Correct.
different. But is Medicare still 65, or does it hinge on and tie to when you're eligible for Social Security?
Great question. In case everybody didn't hear, it relates to Social Security eligibility and Medicare eligibility now that the full retirement age of Social Security is greater than 65. So no, those two, Social Security age and Medicare age, are separate. Medicare at this point is still just an age 65 scenario. That's when your initial Medicare eligibility starts. Again, there's caveats. You could be, once you're on Social Security disability for 2 years, you then become eligible for Medicare. So 40 years old, disabled, on Social Security benefits for 2 years, you then become eligible for Medicare A and B at that point. Again, you work till age 70, you can choose to delay your Part B until then.
That's a good question. Does somebody who qualifies because of a disability, does all this same information apply, or is there other rules for them?
Yep, great question.
Wait 2 years, or are they first eligible for disabled?
So they're not eligible for Medicare until they're on Social Security disability for 2 years. Yep, and then once they're getting that Social Security benefit for 2 years, then they become eligible for Medicare A and B benefits. And then the question is, do all these same rules apply? Yes, with caveat. So have a lot of times folks that are on Medicare through disability opt to get the Advantage plan, because that's still eligible for them. Because the Advantage plans get reimbursed by the government for being your Medicare, the insurance company can't cherry pick. They can't ever ask health questions. Supplements can't either when you first turn 65, but what they have done is, so that same Plan G supplement that's $120 a month for a 65-year-old, for a 42-year-old, that's $500 or $600 a month. So disability supplements, so somebody under 65, the supplement is actually more expensive than the 65-year-old. I guess the assumption is they were disabled, there was going to be more health, more risk.
Yeah.
So what happened was the state said, okay, if you offer a supplement to somebody 65 and older, you also have to offer supplements to those under 65 through disability. And the insurance company said, fine, we'll do that, but the rate's going to be ridiculous. So sometimes it still makes sense. I've had some people on disability that were going through kidney dialysis or things like that, and on an Advantage plan, you've got a 20% exposure there. So sometimes it makes sense if you have that crystal ball to say, you know what, I'm still going to pay the $500 a month for a disability supplement, and that's $6,000 a year. I'm done with it at that point, but very rarely.
We did have one question.
Okay.
Charles Compton.
Okay, yeah, we can do that. If we go up to my website.
The question is, please put up the chart showing the premiums for Part B per income levels.
Can we go? All right. So this is a shameless plug for my website.
That's okay.
All right. So if we go to frequently asked questions and scroll down and then go, how much do I pay for Part B? Then you can click that link. This is just directing you out to the Medicare.gov site. You can close that out. That's just so you don't have to navigate the Medicare site to find it, but you can find it directly there. Scroll down just a little bit. Keep going, keep going, keep going. Keep going. All right, so so Medicare does a 2-year look back on your income. So if you see right there at the top, if your yearly income in 2018 was this is what you'll pay in 2020. The left side is your individual tax return, middle is joint tax return, and then you see married and separate tax return. So the base is $144.60 a month, but it goes up to all the way up to $491. So again, sometimes I'm not trying to get invasive with your clients, but I don't ask income, but usually I will just point out, hey, here's the chart. We do need to make sure, because you could be in a scenario where you're paying $500 a month. So again, if you can't, you can find it through my website as a quick link. You can just Google Medicare Part B premium costs. You can find it on the Medicare.gov website as well.
Have these figures followed the trend in healthcare costs in general, healthcare insurance, or have they kind of got their own?
They kind of have their own. Yeah, so it stayed.
Political.
Yeah, yes, yeah. So
Okay.
the 144.60 was the first increase in 2 years. It does tend to go up every year, but it had held steady. The base had held steady at $135 for 2 years. And then this year is when it went up to 144.60. Something else important too is I have had clients appeal this. So sometimes you might have somebody who had to take stock options or sell their company or whatever, and their income puts them in a different scenario. But they can say, look, I'm not making that now. That was a one-off. You can appeal to Medicare or Social Security, and you may not be hit with that higher amount, the $491. And I've had people win the appeal. It's not a huge process.
Really?
So if your income is kind of one-off
Good to know.
for the year that you're looking at, it's at least worth appealing, because I think they'll do it with a phone call. You just call Social Security and tell them. The worst they can say is no.
Yeah, can that be retro? Like, now that I know that,
I don't know. I mean, you could try it. Like, so if you're paying an income sensitive amount right now, like currently, you could do that. I don't know that they would let you recoup previous years. Probably not, but. So the question is, does the income-based premium stick at that level even after you retire and income drops? So it is a 2-year look back. And then, like we talked about, I probably talked right over your question. But yeah, that after you retire and your income drops, you can appeal that. So if your income 2 years ago was above $326,000 and it puts you in that monthly premium of $462, but you say, hey, now I'm not making that much, you can appeal it, and maybe they won't do a 2-year look back for you.
But the worst case is 2 years, then it'll
Correct.
adjust. Right.
Correct. Yes. Was there another one above that or no?
No.
Okay.
that was it. Okay.
Any other?
With that, I think we'll wrap it up. I thought that was a great program and very informative, and the website looks like a great resource too. Part of the idea of doing these programs is to connect our folks and our friends and clients with resources that can help them solve various problems. This is clearly the case here. So thank you very much, John, for doing the program for us.
Thank you for having me.
Our next program is a breakfast on November 11th. Todd Stanton, who has spoken to this group before, he's the principal and senior employment counsel with Stanton Law Group, will help us understand employee leave law, including FMLA, ADA, and workers' comp. We will have limited in-person spots available and a virtual option as well, just as today. Please be on the lookout for the invitation, and thanks again for joining us.
Thank you, Joe.
You are welcome. Thank you. I'm walking around the room, so I'll put my mask on for you. There's a card here.
Are those magnets?
No, they're Amazon gift cards.
Oh, I think it's better.
You could buy a magnet with it.